So I get a lot of questions about drains after surgery. People wonder, what are drains? Why are they required? Or are they required? I rarely, if ever, use drains. What they are small silicone tubes that go into a surgical site, and they collect in a little pouch that's outside of one's body after the surgery. And the idea is that the drains remove fluid that might accumulate in the surgical area. So one area that they're used very commonly in is after an abdominoplasty or a tummy tuck. So when an abdominoplasty is done, the skin is lifted off of the abdominal muscles so that the muscles can be fixed and tightened, and then the skin is moved and redraped, and then it has to reattach to the abdominal muscles in the healing process. So traditionally, and this is the way I was taught in my residency, or we're going to say many years ago, but we always use drains to evacuate that. There's this potential space that can happen between that layer of skin and the layer of muscles. So in order to obliterate that space, we want to remove the fluid that might accumulate. The problem is that drains are pretty uncomfortable. They require many post-operative visits to care for them, and eventually they have to be removed. So generally speaking, patients hate drains. I hate drains as well. So I've worked with a technique over the past, I'd say 10 or 12 years, called quilting. And what that means is that instead of using drains to close that space, I reattach the skin and soft tissues back to the abdominal muscles after I've done the operation. And it takes a little bit longer, but it has tremendous advantages. It allows the skin to conform and improve the shape of the abdomen. It distributes the tension of the abdominoplasty closure throughout the entire abdomen instead of concentrating all the force at the very bottom of the abdominoplasty closure. And what that means is that patients get better scars because there's less tension on the scar and a much more secure closure. It also obliterates that space between the skin and the muscles so that fluid can't accumulate. And what that means is a much easier recovery with less visits required and greater patient comfort. So that's what I use, called quilting or progressive tension suturing. And I think it's a huge value add for patients. I almost never use drains in abdominoplasty surgery. Other places that they might be used are after breast surgery, for example, in breast augmentation with breast implants. And while the operation is different, I really don't like using drains in breast implants. One of the dreaded complications of an implant-based operation like a breast augmentation is an infection. The implants are not made of our own tissue. And what that means is if there's any bacteria that accumulates, it creates an infection. And because the implant is not our own tissue, it doesn't have any ability to fight the infection. So while drains might remove fluid from around the implant, it also provides a route into the breast where bacteria can get in from the outside. So I find that drains are something that I'll almost never use in a breast augmentation surgery. So I hope that answers some of your questions about drains, and I'd be happy to talk about that with you in person, but I find it to be a much more comfortable recovery. Thanks for listening.